you don't mind, but Linda's a friend.
Not a problem.
Severe abdo pains overnight. She looks like a peritonitis. Cavalry's here.
Hi, I'm Mr. Smedley, the surgical registrar on call. Can we have 75 of pethidine and 10 of Maximum, please, Julie? Tubes?
Yeah.
She felt nauseated all day yesterday, but didn't vomit till last night. Developed severe generalised pain, worse on the right, with guarding and rebound.
Well, you've got gut rot real bad. I can't say what the exact problem is, because I can't examine you properly because you're in so much pain. But we'll give you a painkiller and do some tests.
Thank you.
Have you had your appendix out?
No.
Any chance you could be pregnant?
No chance, no.
Sure?
Yes.
Let's put a nil by mouth and start an IVI. Kefir to be on the safe side.
Last month's patients you were involved with, the previous months, we've had to contact every one of them, offer them all counselling and an HIV test. I just wondered if you had any comment to make, Dr. Mortimer.
Yes. Didn't realise I'd been working so hard. I should be taking it easy in my condition.
Sorry, I know this is painful for you.
It's okay.
I should say now that it wouldn't be unusual for us to have to do an exploratory operation to find out what's amiss.
Don't seem as daunted by the prospect of surgery as most of our patients.
Not if it's going to make me well again.
Sorry about the delay in getting you onto a ward, but there should be a bed free soon.
Not your fault.
I'd say a grotty appendix and a peritonitis.
I concur.
I didn't want to say earlier, but Linda's, highly strong. She's not in the happiest of marriages at the moment.
All right, contact me if there's any problems.
Thank you. It's very good of you to see her for me.
Buy me a beer and we'll call it quits.
Oh, it's a bargain. I might give you a ring later to see how it's gone. Okay?
Feel free.
Sorry to keep you waiting, sir.
Well, there's nothing to write home about there.
Her amylase is normal too. Look, Sis, I've seen this woman before when I was working on the medical side. She was suffering from dizzy spells. The sort of dizzy spells that come on when she needed a bit of attention.
I see.
Astoundingly enough, we found nothing wrong with her. And a couple of months later, she comes back with an overdose. It turns out her husband had left her. She ODs.
And he moves back in.
Exactly.
Julie. Come on. Hey. You was just telling me the patient's past medical history. Look, if there's a possibility that Linda's faking her symptoms, don't you agree it's desirable that her surgeon should be informed?
Of course. What I object to is you discussing sensitive information where it can be overheard.
You're quite right. I apologise.
And you know what probably galls me the most is the glee with which you two want to set about proving that yet another female is being hysterical. Excuse me.
I understand Phil Kirkby has started work with you today, Ernest. Thanks for stepping into the breach.
Well, when I heard his next hospital wouldn't, I felt it was the least I could do.
To be found in error at an inquest is one thing, but have a charge of manslaughter hanging over one's head is quite iniquitous.
Give the wrong injection these days. Time was when a man could get blind drunk, run over his patient with his car, get off scot-free.
Yes.
Glad to see you're still supporting him, Graham. Not many who would have been so magnanimous.
I don't know, Ernest. I just feel obliged to carry on looking out for the boy.
I'm Dr. Mortimer. I'll be the anaesthetist at your operation. I just popped by to say that I was recently diagnosed HIV positive. Now, there isn't any risk to you, but you are at liberty to request another anaesthetist.
All the staff have said I couldn't be in better hands, Dr. Mortimer. I'm perfectly happy for you to be one of my doctors.
Thank you.
Her hemoglobin's come back as 9. I'll check her iron, B12 and folate.
Have you had anemia before?
Not that I know of.
OK, well, it's very mild. Do you suffer with heavy periods?
A bit, I suppose.
OK, we'll have some blood on standby to top you up if we need to. Get some rest. Practice for the anaesthetic.
James, this is the one who's faking it.
Husband seems to have been taken in by it. Oh, darling, I'm so sorry. How could I dally with my secretary, what with you being so ill and all that?
I'd rather she got an unnecessary scar on her belly and mere red face than have to explain why I didn't operate on her because I didn't believe her.
It's the Novak effect again.
Julie could refer to us as a drowned rat. Scissors would agree to perform emergency surgery on it.
It's a clinical decision. It has nothing whatsoever to do with my relationship with Sister Nova.
We didn't know you were having a relationship with her.
Sorry, we just thought that you fancied her and were getting nowhere.
No, Phil, fancying someone and getting nowhere is what sad tossers like you and I would call it. To the wonder from down under, that counts as a relationship.
You all right? You need a hand?
Well, you couldn't, could you? Don't mind if I hit the road, do you? It's just I've got 1,001 things to do.
You know they've changed the rota. Liz, we're on call tonight. Don't tell me you're not brought an overnight bag.
For someone who's supposed to have peritonitis, she's got a pretty poor white cell response.
Maybe you two blokes are more accustomed to birds having to fake it than when I am.
Queer you find diddly wrong with her.
Deal. Now, this is known as the incision of indecision. The thing about opening up the belly is you never know what you're going to find. This way you can extend the cut down towards the pelvis or up towards the stomach. If I assumed it was appendix and then got worried about something further upstream, then this poor lady would be going home with 2 scars. So, your first day of surgery. What do you reckon so far?
It's a lot more direct than medicine.
Heel 'em and wheel 'em.
Have some suction, please.
Yeah. Something serious in there, Scissors?
You don't fancy double or quits, do you? There's a tumour in here.
Damn. Waste of a quid.
I'm pretty confident I got it all out, Mr. Doherty.
Yeah, open and shut, hopefully. I'll ask the lad to be prompt with the report.
Thank you, Mr. Doherty. Sorry to keep you. How are you feeling, Linda?
Oh, sick. Still in pain.
We'll increase the painkillers then.
Thank you.
I'd like to talk to you about what we found. I'm afraid it's a classic case of good news and bad news.
Far away.
Maybe you'd like your husband to be here.
He's had to go to an important meeting tonight. I had to force him. You know what Tom's like.
I'll start with the bad news. I found a growth. It was cancer. Now, sometimes these things can go undetected for months. There's no way of knowing.
You're going to tell me I can't have any more children, aren't you? I wanted another, but Tom said we had to wait.
No. I said there was some good news. I took all the cancer out. Now, we need to wait for confirmation from the lab, but I'm confident it's all gone.
It hadn't spread or anything?
Not that I could tell.
Honestly, Linda, it could be a lot worse. With any luck, this is behind you now. When will you hear from the lab?
Tomorrow.
Right. Well, I think I'll just go and tell Linda before I go.
Do you have to go straight away? Oh, I thought we could have a drink in the social club, if you felt like one.
Oh, well.
There he is.
We're going for a drink.
Kind of marked the end of Phil's first day.
I'll be off. Have fun, boys.
Right, Katie. Okay, just try to relax. Swallow the tube. That's it. Well done. It's the worst part over.
I'm eating a banana. What are you doing? I'm sorry, love. You'll have just call me back.
Get us a sandwich, please, Pat.
I got it. The curry ass wouldn't let you in again.
No, not after the Vindaloo enema incident. Give us a bit of banana.
No, get off.
No! Come on, let's get round the bed.